In theater, mistakes don't happen because people are careless. Mistakes happen when people are careless. They happen when people are rushed. That's why we pause. Today, we'll be talking about one of the most powerful safety tools in modern surgery, the WHO Surgical Safety Checklist. The World Health Organization Surgical Safety Checklist. What if I told you that a simple checklist reduced surgical deaths worldwide? Not a new equipment and not new drugs, just a simple surgical checklist. The following are 3 steps of surgical safety checklist that are followed globally in operating theaters. The first one is sign in. This is before anesthesia is given. And this is done in the anesthetic room by the anesthetist and the anesthetic nurse. So what really happens in that room? The anesthetist will confirm the patient's identity verbally when the patient is still awake with the patient against their wristband witnessed by the anesthetic nurse. And then they confirm again with the consent form, and everything should tally with the wristband, the consent form, and the procedure. Allergies are reviewed at this time. Even though airway risk assessment could have been done earlier in the clinic, in pre-assessment clinic, it will be reassessed again by this anesthetist because maybe this is not the anesthetist who saw the patient at that time in the clinic. They will confirm the last time the patient fed because the patient ideally is supposed to fast for 6 hours and not less. If at all the patient has eaten in less than 4 hours, less than 6 hours ago, that is a high risk patient and the patient could easily choke. And that is why patients are told to fast for 6 hours and more and not less than 6 hours. And then blood availability is confirmed if the patient needs blood, if it's a major surgery. A pulse oximeter will be put in place to monitor the patient and blood pressure. Then an IV cannula will be inserted because the patient will be given anesthesia through the cannula and also be rehydrated through that same cannula. If the patient might need blood, a second cannula will be inserted. As a theater nurse, I have seen how one missed allergy can change everything. This step may feel routine, but it is life-saving. So it is important also to check the patient's allergy before starting anything to prevent any reactions. The second part is timeout. This is actually after you've been put to sleep and you've been wheeled into the operating room, ready for surgery and put on the operating table. I need to clarify here that different places do it differently. Other theaters, timeout will be done before the surgeon's scrub. Everybody will stand around you when you're asleep to again reconfirm that you're the same patient. They will check your wristband again, your name, your date of birth, and your hospital number, and also the procedure that you're coming in for. At this point, the hierarchy disappears. Everyone stops, no cutting, no talking over each other. Other places They do the timeout after the surgeons have scrubbed up, they have cleaned the incision line, and the drapes are on. Then they stop before they cut. Before knife to skin, they will again reconfirm that it is the right patient for the right procedure. It all depends on where you work. This checklist includes team introductions, and yes, even consultants will introduce themselves, student nurses will introduce themselves, everybody introduces themselves and their roles in the operating room. Then it is important also during this time to confirm the site of the procedure, whether site or side must be confirmed verbally. Antibiotics will have been given 60 minutes before the procedure starts. Equipment and readiness will be discussed. Anticipated blood loss will be discussed and how to manage it. Special concerns will be raised. The nurse will be asked if their instruments are sterile and they are happy to proceed. The surgeon will also say what their concerns are. Anesthetist will explain that the patient is okay. If they have blood, they will clarify anything that they have given, and the patient will be ready for surgery. If there is blood, it will also be confirmed. Sometimes the quietest person in the team speaks up during timeout, and this prevents mistakes. This reinforces psychological safety. Sign out is the third one. After surgery and before leaving the theater, this is where many hospitals rush and shouldn't. The surgeon will confirm what procedure he has performed. He will confirm the care he expects for the patient. Instrument count will be confirmed correct by the scrub nurse. Swab count will be confirmed correct. All needles confirmed, and specimens are confirmed, labeled properly. Post-op plan will be clarified, and equipment issues will be documented. Then the anesthetist will speak on his side whether the IV lines have been flushed, because IV lines have been used to give medication that put you to sleep. If they are left with the medication, you will still remain sleepy. It has an effect on the patient. So they need to be flushed so that the medication is out of the IV line. How much fluid will be continued? They'll confirm if they've given antibiotics. They will confirm how much blood they have given, and the blood loss will also be confirmed. Any retained instruments are rare, but when they happen, it's devastating. That's why we count and count and count, and inform the team that the count is correct. At some stage, there may be a retained swab, a deliberately retained swab, depending on the type of surgery, to be removed later on. If everything has been confirmed correct, then the patient leaves theater to recovery or to the destination they have decided to take the patient, like if it was a major case that needs to go to ITU. So I'll say in theaters, safety is never an accident. It's intentional. The WHO Surgical Safety Checklist reminds us when in high pressure environments, we must pause, we must verify, and we must protect. If you found this video helpful, please like, share, and subscribe. And remember, in nursing, we either earn our blessings or earn our curses. The decision is yours. Please remember to follow the surgical safety series that I have created and watch the next video, episode 2. See you in the next video.